Hello, my friends. Welcome back to the Child Life On Call podcast. I am your host, Katie Taylor, a certified child life specialist. Today, we're going to be talking about something that doesn't get a lot of attention, and it's long COVID. And we're going to be specifically talking to a mom whose daughter was diagnosed with long COVID as a preschooler. We've all heard about it in adults, but what about kids, right? So, what happens when a mild case of COVID turns into something bigger, something that lingers and does start to affect their everyday life? And this is exactly what happened to Jessica's daughter. I'll be honest, I still don't know much and I'm still learning about long COVID and kids. So I have done my best to find some resources for you that we will include in all of the show notes. Some of the quickest ones I can find is that the Cleveland Clinic actually has a breakdown of what long COVID looks like in kids. Nationwide Children's Hospital has a practical advice for parents who are navigating post-COVID symptoms in their kids. And there's an organization called longcovidkids.org, which seems to have a lot of helpful information. So those are a few places to start. But as always, I think we learn the most hearing from parent to parent. And so please welcome Jessica, who is a mom and certified child life specialist, and hear from her firsthand about their experience with long COVID. Let's go ahead and get started. Hello, my friends. Welcome to Child Life On Call. This podcast is a safe place for parents to share their stories about what it's like to have a child that has a medical experience, diagnosis, disease, and or everything in between. We know there's power in sharing stories, and that power multiplies when you can listen to other parents who have walked a similar path to yours. Giving and getting advice is great, but hearing how another parent navigates the complexities and nuances of healthcare is even better. As a child life specialist, my role is to support, validate, and provide emotionally safe spaces for kids and their families, and I am so honored to be on this journey with you. In addition to parent stories, we sprinkle in some expert episodes every now and again that have content for both parents and professionals in the field of healthcare, all with the mission to empower parents to be confident advocates and partners with the care team during healthcare experiences. We're so glad you're here. Jessica, you're back on the podcast for a second time. And so I'm
Yes.
so happy to have you here because you just bring the child life specialist brain, but also the parent brain, and you're really well spoken. So I'm so happy to have you.
Thank you. I'm excited to be here.
I was excited that you reached out. We'll be talking about kind of your daughter's diagnosis and spoiler alert, but if you read the title, then you know we're talking about long COVID. And it's something that I have heard about in adults, but not so much children. So I'm glad that you're speaking out on it so that other families may have something like if they've not found answers yet, maybe this is something they can look into. But yeah, introduce yourself and tell us a little bit about you and your family and what you're up to now.
Yeah. So I'm Jessica. I live in Maryland with my two kids, 7 and 3, and my husband. And we have 2 dogs now and 2 cats. So a very full household. I have a private practice where I'm doing both child life and mental health therapy, specializing in kids with chronic illness or kids that have a parent or sibling with a chronic illness. Very, very busy, very full. So it's been great. It's been successful.
That's amazing. Well, you bring such a unique perspective and lens, and I think you know even more the importance of community for parents when you're trying to find an answer. Take us back to since we're talking about COVID, like what was your COVID experience like? When did your daughter get it? And did you get it too? And what was all of that?
Yeah, so we both me and my daughter tested positive in October of 2023. Very mild. Well, I felt crappier than she did. She
Yeah.
had, a little bit of a stuffy nose, stuffy runny nose. Meanwhile, I was so tired and exhausted. I was, very congested, but it was very, very mild for her. And so we did, we isolated, we kept away from my husband and my son because we didn't want them to get sick. So we kind of hung out downstairs and they were upstairs. And yeah, it was very mild. It wasn't that difficult or challenging at all, which is kind of why it was even more surprising, all the stuff that happened afterwards.
Yeah, exactly. And had y'all had it before, or was that your first time having it?
It was my daughter's first time, but it was my second time.
Okay. Okay.
Yeah.
Interesting. I was like, yeah, because 2023, that's pretty good. I can't even remember when we got it for the first time, but I remember being like, we made it all this time and it's still here.
Yeah, the first time I got it, it felt like allergies. I had been vaccinated and boosted, so I'm kind of crediting it to that. And then the second time I hadn't had a booster, and so it wasn't as bad as it could have been, but it still felt rougher than the first time.
Yeah. Well, when did you start seeing some, like, questioning what was happening or going on with your daughter? What was she reporting, and, like, what kind of your gut or mom antenna went up?
Yeah, so at the time she was 2 and she started complaining pretty consistently of pain in only one leg, and it was always her right leg. And at first, both me and my husband just dismissed it as like growing pains, I guess, quote
Right.
unquote. And then December came along and she was repeatedly, repeatedly complaining about it. And so finally I was like, I'm just gonna take her to the pediatrician. And so we went and they did blood work and did an x-ray. Their main concern was like, I guess Lyme disease, because in Lyme disease that presents as knee pain, which I had no idea.
Oh, I didn't know
Um,
that either.
yeah, it was so interesting. But her x-ray came back clean. Her blood work came back clean, no problems. So they said just kind of monitor and follow up if it continued. Meanwhile, she was complaining every day, multiple times a day, that her right leg hurt. And she was pointing to her knee. And so me knowing what I know as a medical professional was like, I don't want to, I don't want to wait any longer. Let's touch base with someone that my daughter had previously seen a physical therapist as a young toddler,
Mhm.
older infant for left leg weakness. And so I texted her and I was like, "Hey, what do you think?" And she's like, "Just come in for an evaluation." So I was like, "All right." So we went, I think it was the end of January for a PT evaluation. And we got there and she was feeling her knees and immediately she goes, "Okay, you're gonna go to ortho. In the meantime, we're gonna put some tape on her knees." So they felt like her knees were subluxating. So her knees were popping in and out, which would result in pain.
Yeah.
So they taped her, told us we need to get a referral to ortho. And in the meantime, can keep the tape on her leg and we would just come back with them every week to reassess. So I, of course, went down a rabbit hole of
Yeah. As we do.
yeah. Yes, knees popping in and out. Like, what is this? Could be surgery, could be just physical therapy. So it took about a month to get in with ortho. So we live in Maryland, um, pretty large hospitals,
Yeah.
within our vicinity. So we went to one of the hospitals and we met ortho there. Had a very bad experience. He was like, she's fine. And I was like, "What do you mean she's fine?" And he's like, "Oh, it's just growing pains." And I was like, "But why would it be in one spot
Yeah.
every day for months now?" And he was like, "Well, she's like, I'm examining her, everything's fine. I can only tell you that it's probably growing pain." So at this point, I was beyond frustrated because
Yeah.
I'm not a first time mom.
Yeah.
I have an older child who did have growing pain, and it was not
Right.
consistent.
Right.
So I decided that I was going to get a second opinion.
Good.
So
The other thing, like, just pointing out, like, toddlers talking about specific pain in one area, like, it's just something to pay attention to because toddlers can be easily distracted or forget that it happened, or it can hurt one day and then they're running right next. Like, it's something to pay attention to when a toddler is that specific. Like, they're not tricking us.
yeah, and the fact that and I think what was confusing to a lot of people is that she was a toddler. So she would complain and say her leg hurt, and then she would get up and start running around and be completely fine.
Right. Yeah.
Um, so yeah, but then there were some days, like there was one weekend I remember she just laid on the couch and she was crying on and off, saying her leg hurt. She didn't want to do anything. She just wanted to lay around, and which was abnormal for a 2-year-old who was,
Yeah.
active. Yeah, so it was very weird. It just didn't seem right. So we went and got a second opinion with another ortho. He was absolutely fabulous. He was so
Mhm.
thorough, and he determined that he felt she fit criteria for an autoimmune disorder. He said that her presentation was like textbook autoimmune.
Hmm.
So he recommended we see rheumatology. And so, well, actually, he recommended we wait a couple weeks and see if it went away and then go to rheumatology. I was
Yeah.
like, I'm not going to wait
Well,
because I
and
know it
it takes
takes
so
time.
long to get appointments.
Yes, absolutely. So we went to rheumatology. Such a long story. So we went to rheumatology and they were kind of puzzled. She didn't have any presentations of like arthritis or anything else. So we did blood work and it came back that she had low vitamin C and low vitamin D, actually almost completely non-existent.
Mhm.
And she did have one other lab value that was elevated, her LDH levels. But they weren't concerned about that at the time. They said it could be vitamin deficiency that can cause leg pain.
Oh,
So start with some supplements and let's go from there. So we did that. We got supplements. After a couple weeks, she was complaining, but not consistently. Like she went from complaining every day to complaining maybe once a week to like
okay.
once every 2 weeks. And then after about 2 months, she started persistently complaining again
Oh,
of pain in the same exact spot. Oh, so I went back to rheumatology and I was
yeah.
like, something's wrong. They did more blood work. And her LDH was still elevated and her aldolase was elevated, which, according to rheumatology, can be a sign of like a muscle disorder. So they sent us to see their neuromuscular doctor that was in the same healthcare system. Talk about bad experiences, like
Mm.
really, really bad experiences. This doctor had decided that the moment my child physically walks in the door, that she was. He was whispering to a student in front of me where I could hear him saying, "Oh, you see how she's walking in and acting totally normal? This child's fine."
Oh my gosh.
Proceeded to bring us into the room, didn't even examine my daughter, and said, "Well, let's talk about growing pains."
Oh my gosh.
I was like, no. By this point, I had like burst into tears and I was like,
Yeah.
no, it was at that point, it was almost a year that she had been complaining of pain by the
Oh
time we
my
got to this
gosh.
neuromuscular doctor. I was like, growing pains don't last for a year and they don't last in the same exact spot multiple times a day, every single day. That makes no
Yeah.
sense.
Yeah.
And I said, I want an MRI. And he
Yeah.
looks at me and he said, well, you're going to have to get that somewhere else.
Wow.
And I said, okay. Packed my kids up, left, went and complained to the front desk, tried to find out how I could file complaints, and immediately called rheumatology and said, I want you to order an MRI because I'm just done with all of this.
Yeah. Oh my gosh. That's so disheartening when you are treated. It's like, it's so, I would have started crying too. And then I hate it because it like builds a case for them being like, oh, this mom, oh, this is, emotional. This is about like, and it's like, no, it's frustration.
And that was one of my fears as this was all happening because when I demanded the MRI, he was like, the deeper you look, the more likely you are going to find something that's wrong. And I'm like, A, that doesn't make any sense because if something's wrong, then
Right.
something we can.
That's why I'm here.
Yeah, but then I started to feel like, oh gosh, he's probably because they're all within the healthcare same health system. Like he's probably reporting to the rheumatologist now, and like they're questioning, like, is this real? Is this mom like purposely doing this? And
Yeah.
and at that point, I had been doing some research about long COVID because
Yeah.
her rheumatologist had suggested it at our very first meeting. And
Right.
I was reading all these stories in Facebook long COVID groups about how parents were not being bereaved and they
Right.
were believing that they were purposely trying to make their kids sick because these symptoms were unexplained. So at that point, I was aware and I was like, oh gosh, like, who
Yeah.
knows what they're thinking of me right now?
Yeah.
It
Yeah.
was, yeah, needless to say, I do not recommend that surgery.
No. And it reminds me of like the nevertheless she persisted. Like we continue on.
Yeah, yeah. So, of course, rheumatology wanted to see us in person. I went back to rheumatology in person in tears and was like, I don't care what I have to sign. Like, if this MRI is just for me because I need peace that there's not something insidious like hiding in her leg that's causing this, like, I will sign the form, but I need to have an MRI done.
Yeah.
She was like, okay, well, yeah, we'll do it. We'll do it. So, meanwhile, MRIs on she was 3 now, has to be
Yeah.
sedated or usually has to be sedated, and they were not booking MRIs until the end of December of
A
2024.
and what month were you guys in?
It was July.
Oh gosh. Yeah.
And so, because I had previously worked at another hospital and I had connections there, I had messaged someone that I knew. And she was like, oh, no, no, we're just booking in October. It was like, I was like, oh, okay, I can do October. I can't do December.
Yeah.
I can do October.
Yeah.
So we got her an MRI, we got her in. Um, the staff knew me, so they knew my personality and what I was like. And of course, because I'm a child life specialist, I had prepared my daughter, and
Yeah.
also her personality is just she's very resilient, and if I can hold her, she's happy. So we
Yeah.
walk in and they're talking about how we had to the way that they do it, they do an IV and they do a drug called Precedex.
Uh-huh.
So it's more of like a natural sleep. It's fabulous, but they have to start an IV first. So I
Yeah.
walk in the room and they're explaining, and I was like, she's gonna do fine for the IV. It's great. She's just gonna sit on my lap. And they looked at me and they're like, you know how we feel about this. And I was like, I know, but I'm going to insist that she be on
Yeah.
my lap. And they just went on. They're like, okay, bye. Are you sure? They're like, promise me, promise me. I was like, I promise you, this kid is not going to move a muscle.
We're so grateful to have Payne's Instant Topical Anesthetic Spray as our sponsor of today's podcast. Help control pediatric procedural pain associated with needle procedures and minor surgical procedures while improving patient satisfaction. Payne's Instant Topical Anesthetic Spray works immediately. It is a non drug and non flammable topical spray that can be used to temporarily relieve the pain associated with minor surgical procedures and needle procedures. Pain Ease is a medical device and does not contain medication. It can be a safe and effective alternative for lidocaine injections when used to temporarily control pain associated with immunizations, IV starts, blood draws, foreign body removals, and suturing or suture removal, to name a few. Paynees works on a 3-step process. First, prepare the site and equipment for the procedure per your facility's protocol. Second, apply Paynees by spraying about a can's distance away for 4 to 10 seconds or until the skin begins turning white. Finally, perform the procedure. The anesthetic effect of Paynees lasts about 1 minute and can be reapplied as many times as necessary. Refer to application instructions for full details. Important risk and safety information. Consult your pediatrician when using on children 4 years old and younger. Do not use on large areas of damaged skin, puncture wounds, animal bites, or serious wounds. Do not spray in eyes. Overspraying may cause frostbite. Freezing may alter skin pigmentation. Use caution when using product on persons with poor circulation. Apply only to intact oral mucous membranes. Do not use on genital mucous membranes. The thawing process may be painful and freezing may lower resistance to infection and delay healing. If skin irritation develops, discontinue use. Caution: federal law restricts this device to sale by or on the order of a licensed healthcare practitioner. Studies suggest that Paynees does not induce vasoconstriction, does not contaminate a site that has been cleansed, and is preferred by patients and practitioners. Paynees comes in 2 different spray pattern variations, medium stream and mist. It is also available in 2 sizes, 3.9 ounces or 1 ounce single patient. Gebauer appreciates the care and comfort that you provide to pediatric patients. Visit gebauer.com/painease with no space to learn how Paynees can make visits more comfortable.
Like, she's going to sit there for you, but she's going to sit in my lap.
Yeah.
And so, of course, she did. She sat in my lap. She cried, didn't flinch, didn't
Yeah.
try to fight or anything. And they were just like, wow. And I was like, yeah,
Oh
this
my
girl
gosh, so many other
for
parents after
years.
you are thanking you for persisting because now maybe they'll believe the next parent that says, "I know my kid and I feel like I know how they'll do."
Yeah, I was just like, yeah, like this when I worked here, that's like I was trying to tell you guys that all the
Yeah.
so I guess it like took me
Yeah.
in going in there and showing them. Yeah, it was crazy. But yeah, she did great, and she, like, went to sleep beautifully. She woke up before I got in the room, and she was just staring at them and was just, like, very calm, and
Mm.
they're like, "She's, like, the perfect patient." And I was like, "I told you she'd be."
Yes.
Uh, but we got the MRI back, and it was negative. There was nothing in there.
Yeah.
And so
How did that make you feel? Did you feel like some sigh of relief that this insidious fear that you had was like you saw like what was happening in there?
yeah, I mean, I felt better because I had convinced myself, of course, with my anxiety that it was a tumor.
Really? I
And
wasn't gonna say the T word, but that's what I would have thought.
yes, yes. So I had convinced myself, like, oh gosh, there's a tumor in there. So I felt relieved, but I also didn't feel relieved because then there was
Right.
no explanation.
Yeah.
And I felt like people were looking at me crazy that like, I kept going back to the doctor. She keeps complaining, but they're not finding anything.
Yeah.
So I was familiar with where we're at. I'm fortunate to have a pediatric long COVID clinic. And since I already
That's
knew
the other
about
thing
it,
I was gonna ask is, like, how
yeah.
did you even know to find that, and are there others in other places? Do you know about them?
Yeah. So there's not very many anymore. I think there's a couple that shut down, I think in 2023. So there's
Okay.
not very many left. I want to say, so I can share with you, I'm in a group and I can share with you they have like a list of long COVID clinics
Okay.
that they are aware are open, and I'm happy to share that with you because I can't think off the top of my head.
Yeah. No, I was
Um,
just kind of asking in general, like, it's so great that you had that resource to go to.
yeah, yeah, and honestly, I knew about it from when COVID was first happening because me being me was like, I'm gonna learn everything I can about COVID, and so I had learned that there was a post-COVID clinic. So I got her referral, and I called them, and I got in like an appointment within like 2 weeks.
Amazing.
We had a fabulous experience. It was like the first time I felt like she was really truly examined, like head
Yeah.
to toe. We saw neurology, we saw physical rehabilitation doctor, we saw
Wow.
psychology. And so I felt like they actually like looked at everything.
Yeah.
And like when I told them we keep getting told it's growing pains. And the neurologist looked at me and said, but that's not growing pains. And I said, I know. I
Yeah.
know. It was such a relief to know that like someone saw and acknowledged that what she was complaining of was not normal
Right.
and that it's not growing pains.
Growing
That's
pains.
not what
Yeah.
growing pains are. And so at the end they said, yes, she meets criteria for post COVID syndrome, which is also known as long COVID. And I was like, okay, like
Yeah.
now I have an answer, and
Yeah.
now I know, even though there's no treatment, I know what to do. But I know that it's nothing bad.
Did you get a referral to do you have to have a referral to go to the clinic, or who did the rheumatologist tell you about it?
Yeah, so through my insurance, we have to have a referral for, like, everything. So,
Yeah.
I did have to get a referral from, I think it was rheumatology that sent in the referral.
Okay, great.
Yeah, yeah.
Wow. So what's their plan? Like, what's their next steps with treating her pain that she has? And have did they give you a timeline for how long COVID lasts?
So it's interesting. They said that there's not very many kids her age that are diagnosed with it. Partially because they're not at that age, they're not very in tune, they're not able to really express, and so a lot of
Mm,
things that might be considered long COVID maybe aren't being explained
yeah.
or able to say what it is. They said that it typically gets better with time, however, reinfections can then bring a flare up as well as
Oh,
like other viral infections. So something
okay.
that I noticed with my daughter is if she gets sick, like she had some sort of bug and she had a fever, she was crying and complaining that her leg hurts. Nothing else hurt, but her leg hurts.
Oh,
Um,
interesting.
yeah, so that can trigger it. But they said it should get better with time. Granted, we're a year and a half ish, or I don't know. I'm not
Yeah.
good with math, past
Yeah.
originally having COVID. So yeah, I'm not really sure. I think from what I've seen in a lot of the long COVID groups, it really is. like a chronic lifelong illness. Like not
Mm.
very many people have had it's not just something that's gone away. They've
Yeah.
continued to have problems. It's just presented in other ways.
And it's like the data, it hasn't been that long since COVID started. So it's just we're learning so much every single day about probably how it affects.
And there's still so much like, I guess, lack of knowledge about like long COVID. For
Yeah.
example, when we were at the long COVID clinic, they actually recommended my daughter see immunology because of how often she's and they said, but go talk to your primary care because you'll probably need a referral from them anyways. And I was like, okay. So I made an appointment with her pediatrician and I specifically said, I just need to come in for a referral for immunology. And of course, they're like, okay, like why? And so I said, well, she has long COVID. She was just diagnosed, blah, blah.
Yeah.
So I bring her in for a healthy well visit, though, just to get the referral. And they wanted to put me in the sick zone. And they said, oh, she has COVID. I said, no, 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 she doesn't
No.
have COVID. They're like, yes, you told us on the phone. I said, she has long COVID. And they just looked
Yeah.
at me and I said, she had COVID in October 2023. Like,
Yeah.
it is now October 2024. And of course, I threw a big sink because here I am there for an immunology referral because she gets sick all the time. And they
Right.
wanted to put her in the zone with all the sick kids. And I'm like, she's not sick. Like,
Yeah.
there's so much misunderstanding and like lack
Mhm.
of knowledge still that I think that's one of the more frustrating things.
It's so frustrating. And it's like, this is like what I try to tell healthcare professionals all the time, and I'm sure you do too. Like the point at which you're interacting with your patient and their family, there's a whole story up until that moment of frustrations, of tears, of questions, of concerns, some great experiences sprinkled in there. So it's like, it's just, we have to meet people where they're at and not put expectations on them of how they should or should not be acting.
Yeah, absolutely.
Mm. So, how's your daughter doing now? And how are you guys kind of handling or coping with the diagnosis you were given?
Yeah, so we're still kind of in the phase of a lot of other medical appointments. So after our really bad experience with a neuromuscular doctor, the long COVID clinic recommended we get a second opinion from their neuromuscular doctor. So
Okay.
we actually just had that appointment last week.
Okay.
Really great experience, super thorough, explained everything really well in terms of like her lab work that was elevated and why he wasn't concerned. What he did find is that she's actually hypermobile in
Mhm.
specifically in her right leg as well, to the point where he actually can't check her reflexes the normal way. So, you know, when they check reflexes and they take the little hammer,
Yeah.
and all they do is just tap it and your leg pops up. Her right leg does not respond to that at all.
Oh,
He has
interesting.
he has to, like, manipulate her knee in a way and then hit it in order to get any sort of reflexes. So, we discovered that she has some hypermobility, which he said could also be contributing. Again, it's this big puzzle, right? Like, it could be
Yeah.
contributing to the overall pain. It could be that COVID also triggered, like, some sort of infection. He said sometimes there's infection in, like, the fluid sac around, like, the joints and stuff, which can be also, like, re-triggered by different illnesses and stuff, so he said that
Yeah.
it's kinda hard to tell, like, what came first, but then it's probably all related, but yeah, she is hypermobile as well, so just another piece to the puzzle of she's just unique.
How do you keep track of appointments and what was said? Like, you have such good recall kind of in your brain, but I know sometimes parents need systems to keep these things going. How do you keep track of everything?
Yeah, I will say I have a really good memory for medical stuff. So it really sticks with me really well. But like I keep track of all the appointments on my calendar. We have a skylight calendar. I don't know if you've seen
Okay.
those.
I've seen
Um,
them on social media. Are they as good as they say?
I love it. I love it.
Yeah.
I really wanted one, so I got one and it's fabulous. So I keep track of all the appointments on there. And then of course when we get information through my chart, then I usually
Yeah.
like download it to my computer so then I have it. But most of
Right.
it I just remember just because I guess I'm good at remembering things.
Yeah. No, you do have good recall. It's and when it's your kid, it sticks with you. You know, like I've been talking with parents and they'll say, I remember on this date, it was this blood pressure. And, it's just like what you can recall when it's your child's well being is pretty
Yeah.
impressive.
Yeah.
What would you recommend to other families who may suspect long COVID? I know you mentioned the Facebook group, so we'll share that, but what else would you recommend to them?
Yeah. My best advice is to just keep pushing. Like,
Yeah.
I feel like, because I have the background and the knowledge, I knew to keep going. Like, I
Yeah.
knew not to just take growing pains as an answer. And I also met a few people along the way that were like, "Well, that doesn't really make sense. So let's
Yeah.
not go with that." So just keep pushing and yeah, like join the Facebook. Like if you think that it's long COVID or it could be, definitely join some of the Facebook groups because they've been
Yeah.
really helpful in just like identifying different providers and like those long COVID clinics and things like that to really help manage like where do we go or what do we look for. But
Yeah.
I would imagine it's still going to be really hard because, even just like pediatricians just don't know very much about it. And as
Right.
COVID gets further from us,
Yeah.
in the sense of like, I want to be careful how I say this because it is still very severe for some
Yeah.
people. But
Sure.
as we get away from more of the severe stuff of COVID, I think that it's likely to become more harder.
Yeah.
Yeah, just because I mean, I was talking to a friend and I was like, "Oh yeah, we just got a long COVID diagnosis for her," and she was like, "Oh my gosh, like I didn't even." She's like, "I don't even think about that. It's
Yeah.
2024. Like
Yeah.
I didn't realize." And I was like, "Yeah, like it's a
It's
thing
still
still."
happening. Yeah. Well, thank you so much for being so willing to share like what it actually does take sometimes to keep persisting, to keep advocating and just having an open mind about what it could be. And also like what we talk about all the time here, you're allowed to go get a second opinion. Like you're allowed to go find the doctor that does listen and you'll be better off for it.
Absolutely, absolutely. Always see a second opinion because you'll feel better, and everyone has different perceptions. If we hadn't seen that second ortho, like, I never would have known to go to rheumatology because I
Right.
would have just thought, "Oh, it's growing pains," or,
Yeah.
but he was so thorough, and so definitely always get a second opinion.
Awesome. And also, like use your resources. You had the physical therapist, you had the friend at the clinic that or at the hospital that you used to work with. Like, it's okay to reach out to those people so that you can make things happen in the way you need to. Like, think about
Absolutely.
all the system does to make it work for them. Like, use the system so it can work for you too.
Yeah, I had messaged one of my good friends who's a child life specialist who has kids with some illnesses as well, and I was running things past her, and she's like, "Keep going, keep going." I
Yeah.
talked to a pediatric nurse on Facebook that I used to work with, and she was like, keep going, like keep pushing."
Right.
So really relying on those people that also have the experience.
Yeah. Well, thank you so much, Jessica, for being here. And I hope that your long COVID is shorter.
Yeah.
The long COVID. But thank you so much.
I-
If you could share how people could follow you and just learn a little bit more about what you do.
Yeah. So you can follow me on Instagram at Kids Can Cope LLC. And my website is www.kidscancope.com. And you can follow me there.
Awesome. Thank you so much.
Thank you.
You guys, I have the best news. If you didn't hear it at the beginning of the episode, Support Spot, our app, is now available for every parent. You no longer need a hospital code to log in. So go ahead and go to childlifeoncall.com/supportspot and download our app today. Hospitals and child life specialists, yes, we are still partnering with you if you want to customize content or provide this app to your families free of charge. We're so grateful that you're here. When you rate and review this podcast, it helps other families be able to find us. So let's keep doing that. And I will see you again here next week.